lot of applicants. So you also don't fall susceptible to the same mistakes. And then I'll go over things you can do for your extracurriculars, um, essays, advice, and advice for your interviews as well. So, it's glitching. Okay, so about me, my name is Pushti. I'm pretty sure I said that before. And I'm currently in the program with NJIT and NJMS. So that's a program in New Jersey, and New Jersey Medical School is actually, I think it has the best match rate out of all the colleges in New Jersey. I know that near you, some programs include the one at Rowan. Rowan has two programs, and then now there's one at Seton Hall as well. So I'm assuming that a lot of you are interested in those, and I can help you out with that. So let me know if you've experienced this at any point, if you felt confused, frustrated, because whenever you look online, there's always contradictory information, no clear guidance, and then there's way too many streams of information. Basically, it makes you not really sure on what you have to do. So just in case this is new to you, let me go over what a BSMD program is. So it gives you admission into medical school at the age of 17 to 18 years old, which is fantastic. And then it makes you a student doctor. Sounds pretty good. And more importantly, you are ahead of the curve and you have that reassurance that you're already into medical school. But as you all know, they are extremely competitive. So I'm going to do what I can to help you out here. This is how you can apply. Most of the time, you apply through the common application. I know that Rutgers doesn't take the common application, but besides that, most of the colleges usually do. And you have to say that you're interested in their BSMD program. And every college does it differently, but most of the time you will have extra essays to do, whether it's for their honors college, whether it's for the BSMD, whatever it may be. And then if you're good, you'll get an interview with the undergraduate institution, and then more essays, more interviews, and eventually you'll be able to celebrate. So this process may not seem as much as it is when I just say it out loud, but it's a really long and really tedious process. So it can lead people to make a lot of mistakes. So I'm going to go over the top 5 mistakes that I see people do a lot of the time, just so you guys don't make them as well. So number 1 is not applying broadly. I'm sure a lot of you have seen like top 20 BSMD program lists, and a lot of people just apply to the top 10 or something like that. But those programs have like an acceptance rate of like 1%. So your chances are extremely low when you apply just to like Brown University or something like that. So my recommendation is applying to a wide variety, apply to ones that are in state. We're grateful enough to be living in New Jersey, where we have a lot of programs in the area. I would apply to competitive and not necessarily non-competitive, but like less competitive programs as well, just so you have like a maximum chance of getting in. And if this is also something that interests you, I would also recommend applying to BSDO programs. That will also maximize your chances as well. The next mistake is not spending enough time on essays. And here's what I mean by that. Sometimes what people do is that they have one essay template, and then based on the word count in the college, they'll just like change it up a little bit and then send it out to everyone else. But in doing that, you kind of limit your creativity, and the essay isn't really geared towards that college. So you're not really going to stand out compared to other people that started writing that essay from scratch and really put a lot of thought into those essays. So make sure that you know what the college is looking for and you know what aspects of yourself makes you fit for that college before you start writing these essays. And you have to make sure that you have like multiple people editing it. You look over it a bunch of times. It's not just something you made right off the bat and then you just pushed out. Next is not showing interest in the university. So A lot of universities look at demonstrated interests as a factor when they admit students, and this includes going to student tours, open houses, whether they're in person or virtual, doing some sort of summer program with them, anything that you're doing with the university that shows that you're interested in them, even talking to an admissions officer, it all counts. And they actually look at that and they have it on your record. So having some sort of interest shows that you're genuinely passionate. And if you're put next to someone that doesn't have that same interest, the person with the interest will come out on top. So I highly recommend that you do what you can to network with the people that are in the admissions officer committee and show your interest overall by going to their events. The next mistake is having cliche extracurriculars. And by this, I don't mean that you have to do something like cure cancer or anything like that, but I just mean that it has to be evident that you're not just doing things for the sake of an application. A lot of people just have the same usual extracurriculars, and it's very obvious that there's no dedication or passion involved. So make sure that when you are doing your extracurriculars, that you can show that you're genuinely interested in it and you're not just doing it for the sake of having it on a piece of paper. And it's not just something that you're doing because everyone else is doing it as well. So that's what I mean by cliche. And also being able to show that you have hobbies and other interests outside of the program that you're applying to will also strengthen your application. Obviously, don't force it, but anything that makes you yourself, you should put it out there. And then the last, and I would argue the most important one, is not having a clear motive for medicine. A lot of people don't spend enough time thinking about why they want to go into medicine. So this may just be like a quick answer that you wrote while you were writing an essay or something like that. But I would highly recommend that everyone sit down for 30 minutes and either record yourself or like journal or something like that on why this is the path you want to take. I would think of, why do you want to do medicine besides another path where you could also help people? Or why medicine over something like nursing? All these other questions that you may get asked in an interview, or other things that are important for you to think about as well. If you have a clear understanding, that will show in your essays, that will show in your interviews, and all throughout your application. So this is like the foundation of your entire application. So it's extremely important for you to know for yourself and for your application for why medicine is right for you. I would also steer clear from using reasons such as that are like superficial, like, oh, my parents, or respect, or money. Pretty sure this is kind of not obvious for most people, but just make sure that there's no idea or there's nothing about you that seems like you're doing medicine for a superficial reason. Okay, so I knew I threw a lot of information. Does anyone have a question before I move on? Okay, I'll take that as a no because I don't see anyone speaking up, so I'll continue. So I'm going to go on to say what our advice is because I told you what not to do. So let me tell you what you can do now. So starting off with just the basics, standardized tests and GPA. So to be a competitive applicant, I would recommend that you have an SAT of around 1500 and an ACT of around 34. This puts you in the pool of applicants that are like heavily considered for these programs. And while programs may accept students' applications that have lower scores, you would definitely need to work 10 times harder to get in. And on top of that, they may not like push your application to the next step with a score that's lower than this. I would also recommend if you can have a GPA of around 3.8 or higher, that's usually like the golden area as well. So obviously it's not just standardized tests and GPA. We also look at extracurriculars. So there are three main extracurriculars that everyone should pretty much have when applying because it shows your understanding of the field you're about to get into. The first one is volunteering because volunteering shows that you can do something outside of yourself to help your community. And that's basically what your role is going to be as a doctor in the future. So it's extremely important. The next is clinical experience, shows that you know what you're getting yourself into and you have some experience to talk about. And lastly is research. I'm sure that's why you guys are all in this club as well. So you do have a little bit of knowledge towards research, but I'll tell you a little bit that I can do to help you. So let's start with volunteering. Volunteering can be done in a lot of different ways, but it's essentially you going out of your way to help others in a way that doesn't benefit yourself. And some experiences that I would recommend include you can volunteer at a hospital or hospice. I know a lot of people volunteered at veterans' homes through an organization like Red Cross, soup kitchens, blood drives, school clubs, local park, whether you're doing cleanup or something. A lot of people volunteer at like a religious institution, through a summer camp, or through a nonprofit, whether this be you volunteering through someone else's nonprofit or creating your own volunteer nonprofit. It all counts as volunteering experience. And these are just some ideas. Obviously, you can do more than that, but if you were kind of stuck on finding experience, this is just some things to think about. Moving on to clinical. I mentioned hospital volunteering already. You can also volunteer at a medical center, whether that's like a private clinic or like an urgent care, something like that, whoever will take you honestly, because clinical experience is a little more difficult to receive. You can also shadow a physician. Physician shadowing is a little bit different than other clinical experience because it's kind of like a required clinical experience, I would say, because it shows that you know what a physician does. And at an age that you're applying at, around 17 or 18 years old, it's really important that you can express that you have that level of maturity and you have an understanding of the field. Because keep in mind, you're competing with people that are 24, 25. So physician shadowing can help you show that. And it shows your commitment as well. So I would highly recommend everyone get some type of physician shadowing. Other clinical experiences that can make your application better are doing EMT or becoming an EMS cadet. In New Jersey, like we're very lucky in the sense where you can become an EMT at the age of 16. In a lot of states, it's actually 18. So if you have the time, if this is something that interests you, EMT is a really great activity to have. And a lot of people also become a medical assistant or nursing assistant. The main idea is that it just has to be an activity where you're directly interacting with patients. So if you're working at like a front desk of a hospital, that doesn't really count as clinical experience. It has to be you talking to them, helping them in a way that a doctor would. And then moving on to research. So I'm sure you're familiar with this, but I'm just going to get through it for the people that may not be. You can get research in multiple ways. So you can do it at a local college near you by cold emailing professors or through a summer research program or internship or something like that. Two different ways. The first one is more long-term. The other one is more short-term. But at this point, whatever you can get is really helpful. So yeah, you can also do a school research program, internships, like I mentioned before. And the goal should be to get as many hours as you can. And if your research project does escalate to that level, you can eventually publish, which will also make your application insanely strong. So here are some research programs and internships in your area. So an example is they have a summer program at Rowan that does research in like the biomedical engineering field. You can go to UPenn. They also have a research academy. Rutgers has one too. I know that might be a little far for some people, but they have a student scholars program, and a lot of people do that. And if you do plan on applying to the program with NJMS, this will definitely help you show that interest, like I mentioned before. And they have a program through Princeton, which is called the Laboratory Learning Program. So these are all like summer programs that you can do, but you can also seek something more long term by emailing at institutions that are close to you. Here's a list of some colleges that you can reach out to, and I'll share these slides with Alex so you guys don't have to like take a picture or something like that. But you can go to like the research field that you're interested in. On the website, they should have a list of staff and emails or phone numbers. And I would definitely look into what they do and then contact them by saying, like, hey, my name is like whatever it may be, and like say why you're interested in their lab and say what experience you have that might make you a good fit for their lab. You may have to email a lot of people, but it will definitely pay off in the long run. So, given all this, a lot of applicants already have volunteering, they already have clinical experience, and they already have research. So, what would make you any different? That mainly comes from like the level of dedication that you can show to these colleges. So, whether you have more hours, whether you have some type of amazing experience, awards, some type of leadership in a club, some type of passion project, and overall just a feeling of dedication. So a lot of people start initiatives of their own. If you lead your own research project, if you are a leader of your own club, stuff like that will all help you stand out in this application process. And this is just in terms of extracurriculars. Later on, it gets more important to also have good essays and make sure your extracurriculars are stated in a good way. And another thing that's really important is also having some hobbies. So in I've personally talked to a lot of people when I was applying to BSMD programs, and I've had multiple admissions officers tell me like, "Oh, hey, you should include your hobbies in your resume, or you should include them in your common application activities section." So if you do have a hobby that you spend a lot of time in, that you feel very passionately about, I would include it. A lot of people play some type of sport or do like dance on the side, whatever it may be. I would definitely include that in your application as well. And the reason being is because medical schools like seeing people that have a way to wind down and a way to do something outside of medicine. Because ultimately, if you don't have that, that actually increases the rate of like med school dropouts and stuff. And they want to have somebody that can withstand the pressure and finish medical school. So having hobbies can help with that. I'm sorry, that may sound a little harsh, but that's honestly the truth. Like hobbies are a really great way of separating work and free time. So moving on to essays. I'm gonna stop again because I was talking for a long time. Does anyone else have any questions or anything like that?
I have a quick question.
Yeah.
Like how would you like include a hobby in your application?
Um, so it's very dependent on the hobby. Do you have like a specific one in mind?
Yeah, like I sing at school and I'm part of a small group at our school.
Okay, so I would include like the small group as the main thing, or you could say like singing in the description, you can say I'm part of this small group. And
Okay.
like if there's a section, there might be like a way for you to write like, oh, this is just like a hobby, something I like doing in my free time. And you would find like some way of calculating the hours that you spend every week doing that. Um, in the in the description though, I would include like this is what like this is how many years of experience I've had, this is why it's important to me, and here's like the impact that I had through my like this group that I'm in. Um, okay, I'm glad that helps. I feel like there's everyone's looking back at someone.
And we have a question here.
Okay.
I think there's like a difference between getting a 1550 and a 1580 on the SAT.
um, yes. So, um, the way it works is it's kind of like a balancing act. So someone with like a 1580, if they had like slightly less experiences and like slightly worse essays, they can kind of get away with it because they have such a high SAT score. But like someone with a 1550, you would have to work a little bit harder on your essays and stuff like that. Like I have a friend that's in my program, she got a 1590 and I had like more experience than she did. But like we both got it in the same place. And that's because it's like a holistic application process, they look at everything. So that would make a difference, but it's not like you wouldn't be considered with a 1550. Like you still have a very competitive shot with a 1550.
I have a question.
Yeah.
So what are the requirements that you have to keep in like undergraduate college while you're in the BSMD program?
So this is also very program dependent, but most of them it's usually like some type of GPA requirement. It's most of the time it's not very difficult. It's like for me personally, it's like a 3.5 that I have to maintain. And nobody in my program is even close to a 3.5 GPA right now. And then we had an MCAT requirement. Not all programs have that, but we did. And ours was a 512, which I don't know if you guys know how the MCAT works, but a 512 is not a very high score. Compared to like if you were a traditional applicant, most people try getting at least a 520. A 512, if I had to turn it in terms of SAT, I would consider it to be like a 1400 or like a 1450. Like it's not that high because if you were applying to a medical school, you would need around like a 15 something to put that in perspective. But a lot of programs don't even require you to take the MCAT. It just depends. But no matter what, I would go into wherever you get it.
I guess it's more of a personal question, but like, have you ever had any like regrets while you were like in the program?
No, honestly, no. Like,
Like, you never like second guessed yourself or thought like maybe like this is too much or anything like that?
um, so if you do have any second guesses about medicine, then maybe like that's something you'd have to consider before applying. But if you're sure you want to do medicine, it's not too much at all. In fact, like, so for us, the only requirement is the GPA and the MCAT. And our requirement includes the MCAT. A lot of programs don't even include that. But if you were a traditional pre-med, you would need like a near 4.0 GPA, a near perfect MCAT. You would be trying to get the highest you can, right? That takes time. And on top of that, you'd be like a traditional applicant that's competitive for normal medical school. They have at least 1,000 hours of research, over 1,000 clinical hours, at least like two-ish leadership experiences. And they're all like EMTs. Most of them have like 500 hours of like paid experience as well. And that's just like scratching the surface. That doesn't even make you stand out. So there's like no pressure whatsoever when it comes to BSMD programs. Like we're all chilling. Like we have nothing going on. Um, yeah,
Yeah,
so it doesn't.
we have like 10 minutes ish left, right?
Yeah, so
Yeah. So like if it keeps it going, we can just switch to the other link.
the other one. Okay, yeah, I'll probably get done with this in 10 minutes, but I'm sure that you guys will have questions.
Yeah.
So we can do that after. Are there any other questions?
I actually had a question.
Yeah.
So when did you start, or if you did you when did you start doing physician shadowing? Or like did you start that in high school or like and how's that kind of process? Did you like reach out to certain physicians you knew or just how'd that process work?
Yeah, so I started in 10th grade and I would recommend for everyone to have like around 100 hours. That's usually good enough. You don't have to go like above and beyond with that. And I reached out to my physician. So I kind of got lucky in the sense that someone that I knew let me shadow them. most of the time I would recommend reaching out to your physician. If not, then you'd have to like Google and start calling offices and be like, hey, can I just come in for like a few days and stuff like that. It's harder to get like a long-term thing, but I do know that a lot of like physicians take in high schoolers as like medical assistants too. So you just have to like keep trying until you find someone that would let you in. Like I know people that shadowed like in the operating room in high school. Like it's definitely possible. You just have to find your connection. Yeah, I saw someone raise their hand.
Yeah, my dad's a cardiac anesthesiologist, so I started going the summer between ninth grade and 10th grade. So I've been in the OR for I think 119 hours right now.
Okay, yeah.
So yeah, I've been going for the last 2 summers in a row, and I still plan to go back. But I've learned a lot from there. So
Yeah, yeah. Like experience like that is kind of like invaluable almost because you learn a lot about like what you want to do, which is really useful because another thing about being in these programs, you don't have to do any of this stuff to get into medical school. So you have a lot more time to prepare for residency. So if you do want to get into a competitive field, you can start that research early. You can start preparing for your residency early as well. So it's like a huge load off your back. Yeah, so the only recommendation I would give towards that is a lot of people also like seeing like you shadowed multiple types of physicians as well. So if you shadowed like 100 hours of one physician versus like 100, but it was like two or three, that would also be a stronger experience. But that's just me nitpicking. Like I'm sure what you have is already great, but that's just another thing to consider. Okay. Anything else? Okay, so I'm gonna move on to essays. So the main essays you guys will all have to write. It all starts with obviously your common application essay, and then that's where it gets a little bit trickier. You'll probably have some type of program essay or like supplementary essay on the common application itself. And then what a lot of programs do is they will send you supplemental essays if you kind of move on to the next step. So they'll send like a smaller cohort of people an extra set of essays. And then obviously you will at some point have to write the why medicine essay, which is also why I said it's so important to know why. So it doesn't sound like your essay's coming out of nowhere. So the main themes people usually say in their essays, and I'm getting this from both the common application prompts and also just things that I've seen in my experience. It's usually showing some type of growth, learning a lesson, showing your passion for something. Like, for example, for Roanoke, it would be singing. Something like that is a possible essay. A problem that you'd like to solve in society, like something related to culture or religion, if that's something that's important to you, something related to teamwork, whether you had like a life-changing experience, something like that. But essentially, you want to show maturity, your passion and dedication, and eventually in your why medicine essay, an understanding of medicine. And then what do you not want to show? You do not want to show intelligence. You don't need to mention your GPA and SAT scores in your essay. Like I've seen people's essays where they said they had like a 4.0. You don't have to write that. They have your transcript, they have your score sends. So it's honestly a waste of characters and it makes you seem conceited. Like I said, don't brag. You don't also have to list your extracurriculars. It's more important to show what they taught you and how they impacted you. So there's a really big difference between saying like I was like a volunteer at a hospital and I had 40 hours versus I volunteered at the hospital and I was really moved by the teamwork that the staff showed and the passion that everyone had for medicine. Like those are two different themes that are being shown. And the first one seems like very impersonal and not really related to your experience. And then you also don't need to go crazy with the vocab. Like, you don't need to use any crazy words. The main idea is to just have people reading your essay for as long as possible. So if you can make your essay engaging and have a lot of readability, that will go a lot further than showing like, oh, I'm so smart, I know this word and what it means. Like, they know you're smart. They have your scores, like I said. And then most importantly, there should be no level of superficiality at all. You shouldn't be like, oh yeah, I saw the doctor pull up in like a Ferrari and I wanted a Ferrari. Like, no. Like, even if that is a factor, like, none of us can deny that like medicine does pay money, right? But that shouldn't be something that you're showing to other people, and that shouldn't be a factor for yourself as well. And then in your why medicine essay, the main thing you want to do is you want to show how your life experiences were meaningful to you. Like I said, the extracurriculars, stuff like that. You want to be able to craft the narrative based on your experiences, any personal things that may have happened to you, and kind of like a lot of people that go in like a chronological order. Like, I had this initial interest and then it built up like this. And then like this was where I figured out that like I wanted to do medicine. And then you also want to show your drive and, like I said, what caused the initial interest, what caused it to build up. You want to show that you understand what the field entails and you're ready to make whatever sacrifices you'd have to make. And you want to show your compassion and your desire to help other people. And like, notice how all of these say show. Like, you shouldn't be saying like, oh, I'm so compassionate. You don't need to say that. If you have like an experience or if you have a description that makes other people realize that you're compassionate, that's more powerful because they made the assumption on their own and they truly believe that. What, like, other than you just telling them like, oh, I'm a very compassionate person. So make sure you show, don't tell at all times. And then I'm going to go into the resume and activity section in the next Zoom meeting just because I'm scared that we're going to get cut
Yeah,
off.
that's fine.
So I'm going to rejoin. Just give me 1 second. I'll be back.
Yep.
Oh, shoot. Okay. Did you send the link to everyone else as well?
Yep. Yeah. So we have it in
Okay,
our
okay.
so everyone can rejoin.
Okay, sounds good. I'll see you all on the other side
All
then.
right. Cool.